Hello, we're going to talk about some CRI math. So some things you want to think about before you get started are what kind of dose are you picking? If you don't know your doses, then you go to the plum or you go to the pay pitch, I can't spell, but either or, you find a drug formulary. And the drug formularies will often tell you what CRI doses you can pick, as well as just regular old one-time bolus doses for pain or for anything else you're giving your drug dosing for. So in this case, I said I was going to pick morphine. I was going to pick a pretty low dose, 0.05 mg per kg per hour, because I know with any CRI I can always go up in dose if my patient is still experiencing pain. And then you're going to ask yourself, how long is this procedure going to last? I need to know how much of this drug to draw up, so that depends on how many hours is the procedure going to take. So if we're assuming stomatitis cat that needs 3 to 4 hour dental, all the extractions, then we're going to again think about, well, how long does the doctor need? How long is this going to take? I usually assume about 3 to 4 hours. Even with some of the best surgeons, they still don't want to just rip out teeth. They're going to take their time. So yes, it's going to take a couple hours, if not a few more. And then you ask yourself also, do I have a syringe pump, or am I running this through an IV bag? Either way, we can figure out the math pretty easily and make it work for the patient. So this particular CRI math is going to be for the patient, rather than we can also do CRI math to figure out how to create a new concentration in a syringe or a bag, and then run that at, say, 1 ml per kg per hour, and that would run on anybody. You could run it on any creature out there as long as the drug is safe for the creature. So if this is a cat, and let's say it's 10 years, severe stomatitis, male neutered, although sex doesn't really matter when you're doing different drugs, at least not for pain relief drugs, and it's going to be roughly 6-pound cat. So the first thing you want to do is go to your calculator, and you want to take your 6 divided by 2.2, because that's the conversion rate to get to kilograms. And now we have 2.7 kilograms. Could you have said 2.73 kilograms to round a little more accurately and get as much accuracy within the drug as you wanted? Absolutely. I'm going to stick with my 2.7. So if I'm going to take now to figure out what drugs I want, I get my 2.7 kgs times that dose of morphine that I looked up in my formulary, which is 0.05 mg per kg per hour. And I go back to my calculator, 2.7 times 0.05 mg per kg per hour, and I'm going to get 0.135. This will be mg per hour. Oopsies. Because the kgs would cross out in that equation. Now, this is only per hour. I've already stated that we're thinking it's going to be a 3 to 4 hour dental. So let's be generous and say that 4 hours of time is needed, times that 0.135 mg per hour dose that we need. Then we're going to take then back to the calculator. I already have 0.135. I'll take it times my 4 hours that I'm anticipating the surgery to last, and I'm going to get 0.54 mg. Again, it's only mgs because if we go back here, hours cancels hours. So now I have 0.454 mg, but we're going to have to get mils, right? I can't add a milligram to a syringe. I can add mils to a syringe. So morphine, pay attention to your morphine because its concentration can be different. It can be anywhere between 1 mg per mil, 2 mg per mil, 10 mg per mil, and 15 mg per mil. And I'm sure there are other concentrations out there, but make sure you know your concentration. Very important. You take your 0.54 mgs divided by mg per mil, which mine currently is 10 mg per mil. And you don't even need a calculator for that one. It's going to be 0.054 mils. I can't draw up that 4 part, so I'm just going to say it's 0.05 mils is what I need for that entire 4 hours. So I also have decided, because I have a syringe pump, because I know cats are tiny, because I know my dose is tiny, I'm going to pick my syringe pump this time. So within that syringe pump, if it's going to run for 4 hours, I'm going to pick my 6 milliliter syringe with the needle on it. 1, 2, 3, 4, 5, 6 mils in that syringe. I'm going to fill it only to the 4 milliliter mark with saline. And then I'm going to add into that my 0.05 mils of morphine. I'm going to mix it up really well. And then I'm going to make sure I attach a IV line, something very small if you have it. A micro bore IV set is ideal because most microbore IV sets have like 0.4 to 0.5 mil that would be held in that line, as compared to your regular IV extension set. Those can be anywhere from 8 mils to, I believe the one I have right now is about 15 mils. So you can see the advantage of a microbore set. I only have a total of 4 mils, so I can't run that in an IV extension set. I don't even have enough fluid to get through the IV extension set. If you don't have a microbore set, you can pick a butterfly catheter, and those can be problematic as well. Even though it's a very short little piece of tubing that's going to go from syringe into the patient, the needle that sticks into the pet, obviously that can get dislodged during your procedure. So you're going to have to check on it more often than not to make sure it's still in the pet, still doing its thing. But regardless of all of that, you want to then run this concoction here at 1 mil per hour, right? Because each one of these mils in here is going to have that correct dose that we went way back up here for. Each one of those mils is going to have 0.135 milligrams in each one of these mils. And that is the correct dose for his kilograms. That's why we did that math way up here. So if you run it at 1 mil per hour, you're actually getting 0.135 mgs per hour, which is perfect because that's what I wanted. So I hope that helps. I hope that makes sense.